William Porter stood at the window of his penthouse on the 45th floor, looking out over the city below. His eyes rested on the old city hospital, a gray building from the 50s. "Mr. Porter, your coffee," Margaret, his personal assistant for the past 15 years, said quietly. She placed the cup of aromatic drink on the mahogany desk and began to list the day's tasks. "There's a meeting with the board of directors at 10 today, a teleconference with European investors at 11:30, and—" she stuttered, realizing that her boss hadn't even returned. "Is something wrong, Mr. Porter?" William slowly turned away from the window. At 62 years old, he looked imposing, tall, fit, with neatly combed gray hair and penetrating blue eyes. "Cancel all meetings for the next 2 weeks, Margaret," he said calmly, sitting down in his leather chair, "and prepare the documents for the temporary transfer of authority to Richard." Margaret raised her eyebrows in surprise. "But tomorrow is an important presentation of a new project. In 15 years, you've never done a single thing." "I understand," William interrupted her, "but there is something more important." He picked up the newspaper the courier had just brought. On the front page was the headline, "Death in a City Hospital. Patient dies due to lack of medication." "Last night I was watching the news," he continued. "They were talking about a woman who died in the city hospital. She was 65, just like my late Elizabeth." His voice trembled, but he quickly composed himself. "Do you know what the worst thing is? She didn't die because of a complicated disease. She just didn't have the right medicine that cost less than $100. Margaret came closer. "You don't think—" "No, it's too dangerous." "That's right." William smiled for the first time that morning. "I will become a patient in the city hospital, an ordinary patient without any special status. But your reputation, if anyone finds out—" "No one will find out," William cut him off, "except you. Find a barber who knows how to keep his mouth shut and buy some simple clothes." At that moment, the study door opened and Thomas, his eldest son, entered. "Dad, I just got the report on," he stuttered, noticing the tense atmosphere. "Has something happened?" William exchanged a quick glance with Margaret. "Nothing much, just discussing my vacation." "Vacation?" Thomas laughed. "You never take a vacation." "That's why I decided to take one," William replied. "The doctors insist on rest." Thomas looked at his father suspiciously. "Are you sure you're okay? Maybe you should see Professor Weber. "I know what I need," William answered sharply. "Take care of the company while I'm gone." When his son left, William turned to Margaret. "I need documents in a different name, and make sure no one can trace my phone." "What if something serious happens?" Margaret asked. "How can I help you?" William pulled out an old watch, the only thing he had left of his father. "My father always said, a person's true worth is not determined by how much money they have, but by how they treat those who cannot repay them." He went to the safe and took out an envelope. "Here are all the necessary documents and powers of attorney. If anything goes wrong, you'll follow the instructions." "This is insane," Margaret whispered. "You're risking everything." "No," William replied, looking at the hospital again. "I'm only risking my comfort. And over there," he pointed to the gray building, "people risk their lives every day. And I want to understand why." That evening, sitting in his office, William reviewed his plan for the last time. In 3 days, he would become David Wilson, a 60-year-old warehouse worker with no health insurance and no savings. And then he would finally see the true face of the healthcare system. Before he turned off the lights, he took one last look at the photo of his late wife. "I'm sorry, Elizabeth, that I didn't do this sooner, but now I will make it up to you." At 8 in the morning, David Wilson, formerly William Porter, crossed the threshold of the city hospital. He was hardly recognizable. A worn brown coat, old shoes, several days of facial stubble. Even his gait had changed. Now he moved more slowly, slouching a bit. The reception area greeted him with noise and stifling air. Dozens of people were sitting on plastic chairs. Some were coughing. Some were holding their stomachs. An elderly woman was crying, clutching her purse to her chest. "Excuse me," he said to the nurse at the front desk. "I need some help." The nurse, without looking up from her paperwork, handed him a form. "Fill it out and wait for your turn." "But I'm in a lot of pain." "Everyone here is in pain," she cut him off. "Fill out the form and wait." David sat down on an empty chair and began filling out the paperwork. Nearby, an elderly man was talking to his wife. "Maria, can we go home?" he whispered. "I've been sitting here for 3 hours and the pain is only getting worse." "Robert, we can't afford a private clinic," the woman replied, stroking his arm. "We'll wait a little longer." On the other side, a young mother tried to calm her child with a bandaged arm. "Quiet, Peter. The doctor will see us soon." "Mom, but we came in the morning," the boy sobbed. David felt anger building in his chest. He was used to efficiency, to an immediate response to problems. And here people are waiting for hours for basic help. An hour later, a new nurse appeared, young, tired, with disheveled hair. Who was the last in line? There was a ruckus. It turned out that no one knew the exact order. "Quiet," the nurse shouted. "We're going to take you on a first-come, first-served basis." "Who determines the urgency?" someone in the crowd asked. "I do," the nurse answered. "Who is in acute pain?" Several hands went up. "Where exactly does it hurt? When did it start?" David watched her quickly assess the patient's condition. Her look was professional, but her eyes showed fatigue and irritation. "You," she pointed at Robert. "And you." She nodded to the man with the bandaged head. "Follow me." "What about the others?" David asked. The nurse gave him a cold look. "And who are you? A doctor? Wait for your turn." By lunchtime, the waiting room was only half empty. David could feel his legs going numb from sitting for so long. An elderly woman was now sitting next to him, taking pills out of her bag from time to time and counting them. "Excuse me," David said to her. "Do you come here often?" "Every month," the woman sighed. "I have diabetes. I come for prescriptions and checkups." "And there's always such a line?" "That's nothing." The woman waved her hand. "It can be worse, especially when doctors are at a conference or on vacation. My name is Anna, by the way." "David," he introduced himself. "Do many doctors go to conferences?" "What conferences?" Anna lowered her voice. "Everyone knows they work part-time in private clinics. They get paid more there. And here," she waved her hand at the shabby walls. At that moment, the paramedics ran into the emergency room with a stretcher. On them was a man, pale as a sheet. "A road accident," one of the medics shouted. "Where is the doctor on duty?" "At the surgery," the nurse answered. "The other one will be here in 20 minutes. He may not live 20 minutes, the orderly shouted. The nurse grabbed the phone. "Call Dr. Weber from the 4th floor, urgently." "He refuses to come down," the voice on the phone answered. "He says he has scheduled patients." David felt his hands shaking. This simply could not happen in his clinics. Every patient was important. Every minute counted. "Take him to the operating room," the nurse finally said. "I'll try to find someone." As the medics ran off with the wounded man, Anna shook her head. "You see, it's like this every day. Doctors run off to private clinics and we wait." In the evening, when David was finally called in for an examination, he felt devastated. Not from the pain he was faking, but from what he saw. From the stories he heard, from the helplessness in the eyes of his patients. "What is it?" the young doctor asked tiredly, not even looking at him. "Chest pain," David answered. "I've had it for a few days. Take off your clothes. We'll do a cardiogram." "When will the results be back?" The doctor finally looked up. "The machine is broken. Come back tomorrow, or the day after tomorrow, when it's fixed." "What if it's something serious?" The doctor took off his glasses and rubbed his eyes. "I saw 30 patients today by myself, without a break. If you are so urgent, go to a private clinic. They will serve you in 5 minutes." When David left the office, it was already dark. At the entrance, he saw the same boy with his arm bandaged, still waiting with his mother. "Are you still here?" David was surprised. "The X-ray is not working," the woman answered tiredly. "They told me to come back tomorrow." On the way home, David thought about everything he had seen, about tired doctors and irritated nurses, about broken equipment and endless queues, about people waiting for hours for help. In his hotel room, he pulled out his phone and dialed Margaret's number. "It's only the first day," he said instead of greeting her, "and it's much worse than I thought." The next morning, David was transferred to a general ward. The room was cramped and stuffy, with 4 beds separated by a thin curtain. The mattresses were thin and the linens were outdated, though clean. "Your place is by the window," said Nurse Olivia, pointing to the last bed. "Breakfast at 8, lunch at 1, dinner at 6. The toilet is at the end of the corridor." "Where can I wash?" David asked. "There is one shower on the floor," she answered. "The schedule is on the door. Your time is at 9 in the evening." When the nurse left, David began to look at his roommates. To his right was a thin man in his 50s who was coughing incessantly. To his left was an elderly patient with a bandaged leg. The 4th bed was empty, but someone's belongings were on the bedside table. "Good morning," the sick neighbor greeted me. "My name is Michael, and this," he nodded at the elderly man, "is Peter." "David," he introduced himself. "How long have you been here?" 4 days, Michael replied between coughing fits. "Pneumonia. I'm waiting for the test results." "You've been waiting 4 days for the results." David was surprised. "The lab is overloaded," Peter explained, "and I've been here for 2 weeks, after my knee surgery." At that moment, the door opened and a 4th patient entered the room, a young man with a bandaged arm. "Oh, Nicholas is back," Michael said. "How are the treatments going?" "The usual," he grimaced. "The physiotherapist didn't show up again. They said he was sick and there was no replacement." David listened to his neighbor's conversations, trying to comprehend what he was hearing. In his private clinics, the test results were ready in a day at the most, and replacement staff was found instantly. "What happened to your arm?" he asked Nicholas. "An industrial injury," he replied. "I work at a construction site. I fell from a scaffolding a month ago. Now I'm waiting for it to fuse up." "And how long will it take?" Nicholas shrugged. "The doctor says he needs an additional surgery, but the waiting list for scheduled surgeries is 3 months long." 3 months? David couldn't believe it. "What about work?" Nicholas smiled bitterly. "They fired me. They said they couldn't keep the place for that long." A nurse entered the room with a tray. "Breakfast," she announced, handing out plates. David looked at his portion. Liquid oatmeal and tea in an aluminum cup. He remembered his usual breakfast with freshly squeezed juice and muffins. "Don't worry," Michael winked at him. "You get used to it quickly. The main thing is to have the medicine." "And what about the medication?" David asked. "It depends," Peter answered. "Sometimes they have them, sometimes they tell us to buy them ourselves. Yesterday, for example, there were no antibiotics. Relatives buy them if they have money," Michael said. "And if not, we wait." After breakfast, the rounds began. A young doctor entered the ward accompanied by 2 interns. "How are you feeling?" she asked, approaching Peter. "My knee hurts," he answered, "and the bandage hasn't been changed for a long time." "The dressing nurse is on vacation," the doctor sighed. "I'll try to find someone by the evening." After examining all the patients, she came to David. "Do you still have chest pains?" "Yes," he replied, "especially at night." "The machine is still not working," she said, "but I'll prescribe you some nitroglycerin. If it gets worse, call the nurse right away." When the doctors left, Michael shook his head. She's a good doctor, Dr. Williams. She's trying. But what can she do? The equipment is old, the staff is short. After lunch, soup and pasta with canned fish, Nicholas's wife came to see him. A young woman with a tired face brought fruit and water. "How are you?" she asked, sitting down on the edge of the bed. "I'm fine," he answered. "How are the kids?" "They miss you. Lucy asks when Daddy will come back." "And the money?" She sighed. "I took an extra shift at the cafe, but the rent will be hard to pay this month." David turned away, feeling that he was overhearing something very personal. He thought about how many stories like this happen every day in this hospital. In the evening, the temperature in the ward began to drop. It turned out that the heating was working intermittently. "It's a good thing I took an extra blanket," said Peter, wrapping himself up. "My wife realized from the first week that it was cold here. I thought it wouldn't last long," Michael sighed. "I didn't bring anything warm." David lay in the darkness, listening to Michael's coughing and the heavy breathing of the other patients. He thought about how in his own hospital, each room had a separate thermostat, and the patients could regulate the temperature themselves. Around midnight, he heard a noise in the corridor. Someone was shouting for a doctor. "It's from Ward 7 again," Peter muttered. "There's an old man with a heart condition. It's been like this for 3 nights. "What's wrong with him?" David asked. "He needs an operation, but you can wait 6 months for a quota for a free operation, and there is no money to pay for it." David felt his throat getting dry. He remembered his office, where he made decisions about budgets and investments. How many times had he refused to fund hospitals like this, considering it unprofitable? In the morning, he was woken up by the sound of drops falling into a bowl. It turned out that the ceiling in the corner was leaking. "It was after yesterday's rain," Michael explained. "The administration has been promising to repair it for 2 years. "And no one does anything?" David was indignant. "Who cares?" Nicholas sneered bitterly. "We are not paying patients from private clinics." David felt himself blushing. He remembered his luxurious room in the Swiss clinic where he had been treated last year. Back then, it seemed normal to him to pay thousands of dollars for comfort. And here, people are happy to just get the medicine they need. David's 3rd day in the hospital began with the sharp voice of his nurse, Christina. "Wake up, everyone! Get ready to take your temperature." Barely opening their eyes, the patients saw a stout, middle-aged woman with a tablet in her hands. "Wilson!" she barked. "Where's your temperature chart?" David looked around in confusion. I don't know. No one gave me one." "Great!" Christina snorted. "First day on shift and already problems. Who was on duty yesterday?" "Nurse Olivia," Michael answered quietly, still coughing. "Oh, that Olivia," Christina muttered. "The young people are gone. No responsibility, no experience. All they think about is how to move to a private clinic as soon as possible." She shoved the thermometer roughly under David's armpit. "Lie down and don't move. I have 2 more floors to go around." When she left, Peter sighed. "Don't mind her. Christina is always like this. She's been working here for 20 years. She's just bitter." "What about Olivia?" David asked. "She seemed normal." "She quit," Nicholas answered. "I heard her on the phone yesterday. She was hired at medical center for a better salary." Half an hour later, Christina returned, still irritated. "So, who has a fever?" "Wilson, 37 and 5. I'm writing it down as elevated." "But that's normal," David began. "Listen," Christina interrupted him. "I've been working here for 20 years. Don't tell me how to fill out the cards. If it says promoted, it means promoted." At that moment, a scream was heard from the neighboring ward. "Nurse! Urgent! A man is sick here!" Christina rolled her eyes. "Oh God, here we go again. Why does everyone feel sick in the morning?" She slowly left the ward, muttering something about simulators and hysterics. "We're lucky to have her," Michael said. "But the night shift. Martha. She might not even come if you call her." After breakfast, Dr. Williams came into the ward with a group of interns. After examining the patients, she came over to David. "How are you feeling? Do the pains continue?" "Yes," he answered, "especially at night." "The ECG machine is still being repaired," she sighed. "But I've arranged for a cardiologist to come and see you this afternoon." David noticed one of the interns whisper something in her ear. "What? Again?" She looked at her watch in alarm. "I'm sorry, I have to run. We have a problem in the intensive care unit." After they left, a new nurse came into the room, a very young girl with kind eyes. "Good morning. I am Sophia. I will be giving you injections today." She carefully and quickly administered all the necessary injections while managing to encourage each patient. "You see," she smiled at David, "it doesn't hurt at all." "Thank you," he replied. "Have you been working here recently?" "For 2 months," Sophia nodded, "after medical school." "And how do you like it?" Her face grew a little gloomy. "It's hard, very hard, especially when you see that you can't help as much as you would like. There is a lack of everything: medicines, equipment, staff." At that moment, I heard Christina's voice in the corridor. "Sophia, why are you stuck there? We have 3 more wards waiting for you." "I'm coming," the girl responded and quickly left. Before lunch, an orderly came into the ward, a gloomy man in his 40s. "So, who asked for a ship?" he asked loudly. Peter raised his hand. "I did, an hour ago." "Here it is." The orderly carelessly put the vessel by the bedside. "Can you handle it yourself, or do you need help?" "I can handle it," Peter answered quietly, blushing. In the afternoon, the promised cardiologist came, an elderly man with a tired face. Well, let's see what we have here," he muttered, taking out a stethoscope. He listened to David carefully, asked a few questions, and suddenly frowned. "Have you ever seen a cardiologist before?" "No," David lied. "There is clearly something chronic here. We should do an ultrasound of the heart." "And when is it possible?" The cardiologist shrugged his shoulders. "There's only one machine for the whole hospital. The waiting list is 2 months long, unless—" He made a significant pause, but David decided not to take the hint. "Well," the doctor sighed, "we'll treat you symptomatically. I will prescribe you nitrates." In the evening, Nicholas's wife came to see him. She looked upset. "Can you imagine? Today the nurse at the registration office was rude. She said that I come in too often and interfere with their work." "Who was it?" Nicholas asked. "She was so fat, with glasses." "Oh, that's Christina," Michael interjected. "She's rude to everyone. Don't take it to heart." Late in the evening, when everyone was falling asleep, the night nurse Marta came into the ward. She smelled slightly of alcohol. "So, who here needs painkillers for the night?" she asked, loudly rattling the ampoules. "Me," Peter answered. "And Nicholas." "2 at once?" Martha grimaced. "Maybe 1 will be enough?" "We're saving money on drugs." David could not stand it. "Listen, if the doctor prescribed it, then both of them need it." Martha measured him with a heavy look. "You're new here, I see. Don't you know our procedures yet? If you quarrel, no one will get anything at all." She did give him the injections, but deliberately roughly, so that Peter cried out in pain. "That's all," she said, collecting the empty ampoules. "Just don't try to call me in the middle of the night again. I have not only your room." After she left, the ward fell silent. "You know," Michael suddenly said, "my wife used to be a nurse. 30 years ago. She quit because she couldn't stand to watch everything go downhill. She said, 'We used to be like a family. Doctors, nurses, orderlies. Now it's every man for himself.'" David couldn't sleep for a long time that night. He thought about Sophia with her sincere desire to help, about tired Dr. Williams, about angry Christina and drunken Marta. All of them were part of the same system, a system that was breaking patients and staff alike. The morning of the 5th day in the hospital began with disturbing news. Nurse Sophia, making her morning rounds, looked particularly upset. "We're running out of antibiotics," she said quietly, checking Michael's IV drip, "and the new supply will be here in a week." "But I still have 4 days left in the course," Michael coughed. "I know," Sophia was almost crying. "We're trying to think of something. Maybe we can borrow it from another department." At that moment, Dr. Williams entered the room, accompanied by an elderly man in an expensive suit. "This is our head doctor, Dr. Bergman," she introduced him. "He makes his monthly rounds." Dr. Bergman gave the ward a quick glance. "How are the conditions? Any complaints?" "Yes," Nicholas immediately responded. "We've had a leak in the ceiling for a week now, and—" "It's a matter of housekeeping," Bergman interrupted him. "I mean medical complaints. Is running out of antibiotics a medical complaint?" David could not stand it. The chief doctor looked at him with irritation. "Young man, do you realize the situation the healthcare system is in now? We are doing our best within the allocated budget." "What are patients supposed to do now?" David asked. "Wait a week without medication?" "There is an option to buy the necessary medicines on your own," Bergman replied dryly. "At the hospital pharmacy." When the bosses left, Peter shook his head. "That's the whole system, and the prices at the hospital pharmacy are twice as high as in the city." "Why?" David wondered. "Because it's their pharmacy," Michael explained. "Everyone knows that it belongs to a relative of someone in the management. In the afternoon, a crying woman came into the ward, the wife of a patient in the next room. 'Can someone lend me 2,000?' she begged. 'Her husband urgently needs medicine, and we've run out of money.' The patients looked at each other. No one could help with such a sum." "What about insurance?" David asked. "What insurance?" The woman smiled bitterly. "Her husband was working unofficially when he got sick. Now everyone turned away." In the evening, David overheard a conversation between Nurse Sophia and Dr. Williams. "Anna Mikhailovna," Sophia said, "maybe you can think of something? In the 5th ward, my grandmother is running out of insulin." "What can I do?" the doctor replied tiredly. "You know that suppliers refuse to work with us until the hospital pays off its old debts. But you can't just—" "Yes, we can, Sophia," Williams interrupted her. "That's exactly what happens every day. We can't help everyone. Some people have relatives who will buy medicines, and some—" She did not finish. Late in the evening, an orderly came to the ward to deliver dinner. Suddenly, he heard noise and screams in the corridor. "What do you mean there is no medicine?" a man's voice shouted. "Are you kidding me? A man is dying." "Calm down," someone from the staff answered. "There's nothing we can do. Try to buy some at the pharmacy." "What pharmacy? At 10 o'clock in the evening? Do you even realize what you're saying?" David could not stand it and went out into the corridor. There stood a young man shaking the frightened doctor on duty by the collar. "What happened?" David asked. "What happened?" The man let the doctor go. "My father is sick. He needs a drug urgently, and they're out of it, you see. And this is in a hospital, in a public hospital." "Maybe I can help?" David asked, thinking about his connections. "How can you help?" The man waved his hand. "The whole system is rotten here. You know what they told me at the reception desk. If you want proper treatment, go to a private clinic." The next morning, David learned that the man's father had died. He had a heart attack. The drug the hospital didn't have was less than $100. "Isn't this the first time you've seen this?" he asked Michael. "No, it's not the first time," he sighed. "Last week, a guy died in the intensive care unit, 25 years old. There was no medicine for anesthesia, while his family was looking for money." At that moment, Nurse Christina came into the room with a piece of paper. "Okay, everyone, an announcement from the administration. Due to cost optimization, the purchase of some medicines will be reduced next month. The list of medications that patients must buy themselves is posted on the bulletin board." "What's on it?" Nicholas asked. "It's easier to say what's left free," Christina snorted. Even bandages are now at your own expense." In the evening, Sophia came up to David. "You know," she said quietly, "I handed in my resignation today." "Why?" He was surprised. "You love your job so much." "I do," she nodded. "But I can't look patients in the eye anymore and tell them there is no cure. I can't listen to them ask for help, and we are all powerless to change anything." That night, David couldn't sleep for a long time. He thought about how many people face this situation every day, about how the system turns young idealists into tired cynics, how easy it used to be to think about cost optimization while sitting in his office. He took out his phone and wrote a message to Margaret. "Find me complete information about the drug procurement system in public hospitals. Who makes the decisions, who the suppliers are, where the money goes. Everything." That evening, the ward was especially quiet. Michael was sleeping after another coughing fit. Peter was reading an old newspaper, and Nicholas was looking out the window at the rain pattering on the windows. David felt it was time to start having more open conversations with his neighbors. "Peter," he said quietly to the elderly man, "how did you get here in the first place?" Peter put down the newspaper and sighed heavily. "It's a stupid story, really. I was working as a guard at a construction site. One evening I slipped on the stairs and got a fracture. At first I thought it was nothing, it would heal, but complications began to arise." "How long have you been here?" 3 months now," Peter smiled bitterly. "Do you know what the worst thing is? I could have gone to a normal clinic. I had insurance from work. But the bosses quickly solved this issue. They fired me retroactively, as if I had left before the injury." Nicholas suddenly interrupted the conversation. "I know the story. They did the same thing to me. Only in my case, they didn't even try to explain anything. They just said goodbye, and that was it." "What did you do?" David asked. "David, me?" Nicholas turned from the window. "I was a construction worker, 15 years of experience. I started as a simple laborer and worked my way up to foreman. I thought everything was going well. Normal salary, stable work, and then one careless step on the scaffolding." He pointed to his bandaged arm. "Doctors say it may not recover completely. And without full function of the arm, what kind of work can I do? My wife now works 2 jobs, as a waitress and a cleaner, and we have 2 children." At that moment, Michael woke up. "Are you telling stories again?" He coughed. "Then listen to mine." He sat down on the bed, leaning on the pillow. "I've been a truck driver all my life. My own truck, my own route. Everything was fine until this pneumonia started. At first I thought it was a cold, it would go away. I continued to drive because every missed trip means lost money." "And what happened next?" David asked. "And then it was like a bad movie," Michael smiled bitterly. "One day I was driving so badly that I barely managed to pull over. An ambulance brought me here. It turned out that I had advanced pneumonia and I should have been treated a month ago." "Why didn't you get treatment?" "Try living without work for a month when you have a loan for an apartment and a sick dependent mother," Michael replied. "I thought I could handle it, but I didn't." Footsteps were heard in the corridor and a new patient entered the ward, a man in his 50s, accompanied by a nurse. "This is your place," she said, pointing to an empty bed. "Make yourself comfortable." When the nurse left, the newcomer introduced himself. "Robert, a heart attack victim." "And how did you get admitted here?" David asked. Robert waved his hand. "I spent 4 hours in the waiting room. Then I waited for another 2 hours for a cardiologist. And when they finally examined him, they said he needed an urgent operation. But there was a waiting list," Peter suggested. "Yes, there is. They said I had to wait for 2 months. In the meantime, I need medications and observation." "And a private clinic?" David asked. "Are you kidding?" Robert shook his head. Such an operation costs as much as my annual pension. I was a teacher, 30 years of experience. I thought I'd retire and take care of my grandchildren. And now," He did not finish, but everyone in the ward understood. I had a neighbor, Peter suddenly remembered. He was discharged last month, so he told me that his friend works in a private clinic as a cleaner. He said that even the waste baskets there are better than the beds here. And their equipment is new, Nicholas added. When my arm was examined for the first time, the doctor said I needed a CT scan, but the machine here is broken. He advised me to go to a private clinic. I asked about the price, and it turned out to be my monthly salary. Do you know what the funniest thing is? Michael interjected. I overheard a conversation among the doctors. It turns out that many of them work on two fronts, here and in private clinics. They work there for money and here for seniority and pensions. What's so funny about that? Robert asked. The fact that the same doctors in different places are like different people. Here they are gloomy, tired, and don't want to explain anything. And there they are smiling, attentive, ready to talk for hours about your illness. David listened to these conversations and felt anger rising inside him. He remembered his own private clinic, where even the furniture was ordered according to an individual design. And here, people can't get basic help. What do you do? Robert suddenly asked him. David was confused for a moment. I used to work in management. I'm retired now. And how do you like it here? Robert asked. You must not be used to such conditions? No, I'm not, David answered honestly. He couldn't find the word. Terrible? Peter suggested. Unfair? Exactly, David nodded. You know, all my life I've believed that if a person wants to get quality medical care, he or she has to pay for it, that it was normal to have different levels of service for different people. And what do you think now? Nicholas asked. Now. David looked out the window where it was still raining. Now I realize that I was wrong, that you can't make a business out of medicine, at least not in this form. Beautiful words, Michael said, but what good are they? The system is well established, everyone benefits, someone gets more, someone gets less, and we are just cogs in the machine. That night, David couldn't sleep for a long time. He thought about all the stories he had heard, about the teacher who couldn't afford surgery, about the construction worker who was thrown out on the street after an injury, about the driver who ruined his health for fear of losing his job. He took out his phone and wrote another message to Margaret. Tomorrow, make a request for all documents on the privatization of medical institutions over the past 10 years, and find information about the owners of private clinics in our city. I think I'm starting to understand how this system works. The 7th day of his hospital stay began with an unpleasant incident. A woman in a business suit came into the room, introducing herself as an employee of the administrative department. David Wilson? She looked through the papers. You have an overdue bill for additional services. What additional services? David was surprised. Tests, cardiogram, cardiologist consultation. She read off the list. The total amount was $800. But this is a public hospital, Nicholas interjected. Shouldn't it be free? The woman looked at him with contempt. Basic treatment, yes, but additional services are paid for separately. It's written in the documents you signed when you were hospitalized. I didn't sign anything like that, David protested. Really? She pulled out a folder. David looked at the document. The small print at the bottom did indeed say something about additional services. I can't pay right now, he said, sticking to his story. Well, the woman smiled coldly. In that case, we will have to stop your treatment. Dr. Williams, who had just entered the room, suddenly interrupted the conversation. What's going on here, Maria? Anna Mikhailovna, you know the rules, the administrator replied. Debts have to be paid off. The patient has not yet completed the course of treatment, Williams said firmly. Then perhaps you will personally pay off his debt, Maria asked sarcastically. The doctor fell silent. David could see her struggling with herself. "Give us a few days," she finally said. "I'll talk to the head doctor." After the receptionist left, a heavy silence fell in the ward. "Don't worry," Michael tried to cheer him up. "Everyone here has debts." "It's not about debts," David replied quietly. "It's about the way people are treated." Later that day, Nurse Christina came up to him. "Listen, Wilson, we need to talk." She took him aside. "I know something about your payment problems. I can arrange a, how shall I put it, individualized approach." "What do you mean?" "Well," she lowered her voice, "there are people who can help. Of course, it will cost a little more than the official bill, but there's no paperwork and no questions asked." David felt his hands tremble with anger. "Are you suggesting that I bribe you?" Christina shouted. "That's rude language. It's just, thank you for your understanding. Everyone does it." "Everyone?" "Well, not everyone, but those who want to get proper treatment. By the way, we have an excellent cardiologist. If we agree, he can see you out of turn." "What about other patients? Those who can't return the favor?" Christina shrugged her shoulders. "That's life, dear. Everyone makes do as best they can." When David returned to the ward, he found Robert excited. "Can you believe they just told me that the surgery will cost $5,000? But I read that it is included in the state guarantee program." "It is," Peter confirmed. "But you'll have to wait about 3 months. If you want it sooner—" "3 months?" Robert clutched his heart. "But the doctor said it's urgent." "Calm down," Nicholas intervened. "Maybe your family can help you." "What family?" Robert smiled bitterly. "My wife died 2 years ago. His children are in another city, and they are barely making ends meet." In the evening, a young doctor, an intern whom David had seen earlier with Dr. Williams, came into the room. "Excuse me," he said quietly. "I heard about your situation. Perhaps I could help you." "How?" David asked. "I have a friend in social services. He can get you a low-income status. Then the treatment would be free." "Is this legal?" "Not really," the intern admitted. "But sometimes you have to look for workarounds. Otherwise, people just die waiting for help." At that moment, a noise was heard in the corridor. Some woman was screaming, "Why can't you take him? He has a temperature of 40." "Calm down," the nurse's voice answered. "We have no right to take you without paying for previous services." "What services? What payment? Don't you see, the child is fainting." David went out into the hallway. A young woman was holding a boy of about 6 years old. The child was pale as a sheet. "How much?" he asked the nurse. $320 for the previous hospitalization," she replied. David almost gave himself away by automatically reaching into his pocket, where he always kept his wallet with cards. He stopped in time, remembering his role. "Isn't it possible to enter the situation?" he asked. "This is a child." "The rules are the rules," the nurse said. "It's nothing personal." That night, David wrote Margaret the longest message of his experiment. Find all the cases of denial of medical care due to non-payment for the last year, all complaints, all appeals, and also prepare data on how much the equipment for the children's department costs, complete re-equipment, and a list of the best pediatricians in the country. I think I know where to start the changes. That morning, the hospital was particularly noisy. David woke up to the sound of an argument in the corridor. He recognized the voice of the young intern, Thomas Weber, who had offered him help yesterday. "This is unacceptable," Thomas said in a raised voice. "He has acute appendicitis. He needs urgent surgery." "Calm down, colleague," replied the calm voice of Chief Physician Bergman. "You know the rules. Without full payment—" "What rules?" Thomas interrupted him. "He's going to die if we don't operate immediately." David quietly approached the door of the ward. Several nurses and doctors were gathered in the hallway. A young intern stood in front of the head doctor holding some papers. "Listen, Thomas," Bergman spoke quietly but firmly. "You are a young, promising doctor. You have your whole life ahead of you. Why create problems for yourself? Problems? Thomas smiled bitterly. The only problem here is that we have forgotten the Hippocratic Oath. The deputy chief physician, Dr. Miller, joined the conversation. Colleague, you realize that a hospital is a complex mechanism. We need money for equipment, medicines, staff salaries, and so we should refuse to help people? Thomas did not give up. No one is refusing, Miller replied calmly. There are just certain procedures. By the way, many patients find ways to express their gratitude to doctors. Thomas suddenly straightened up. Are you suggesting that I take a bribe? God forbid! Bergman raised his hands. It's just that sometimes patients make voluntary contributions to the hospital. Unfortunately, we can't help everyone, Miller sighed. This is the reality. David saw the young doctor clenching his fists. You know what? I'll pay for this operation myself. From your intern salary? Bergman shook his head. Don't talk nonsense. Better think about your future. At that moment, a gurney was brought in from the emergency room. A pale man was lying on it, writhing in pain. Is this the same patient? David asked Sophia, a nurse who was passing by. Yes, she answered quietly. A regular taxi driver, 3 children. Wife doesn't work. Thomas rushed to the gurney. Hold on, I'll think of something. You have half an hour, Bergman said. Then we will have to send the patient to another hospital. David broke down and went out into the hallway. What if I pay for the surgery? Everyone turned to him. You? Miller asked in surprise. But you have a debt to the hospital yourself. I'll find the money, David said. I'll call my family. Thomas looked at him gratefully, but Bergman shook his head. Unfortunately, we can't accept payment from another patient. It's against the rules. All day, Thomas ran around the hospital trying to find a way out. David watched with a pained heart. He could have easily solved the problem, but that would have meant revealing his identity. In the evening, he heard Thomas talking on the phone. Yes, Dad, I understand everything, but I can't work like this. It's not medicine, it's... He stopped talking. No, I've already decided. I'm handing in my application tomorrow. The next morning, Thomas was not at the hospital. When David asked Sophia about him, she sadly replied, He quit. He said he was going to work in a rural clinic. At least they are honest there. What about that patient? David asked. David. They sent him to another hospital, 40 kilometers away. Will he survive? Sophia looked away. I don't know. With appendicitis like this, every hour counts. That evening, David made a decision. He took out his phone and texted Margaret. Prepare the documents urgently. Tomorrow we start acting. Find all the information about the hospital's management, financial flows, unofficial income, connections with private clinics, everything. An hour later, I received a reply. I've already found it. You'll be surprised, but the chief Dr. Bergman is a co-owner of 3 private clinics, and his deputy, Miller, owns a chain of pharmacies, including the one at the hospital. David smiled. Great. Now find the contacts of all the journalists who have written about the problems in the healthcare system, and prepare a report on all cases of denial of care over the past year. Are you sure? Margaret asked. It will be a scandal. That's exactly what we need, David replied. And one more thing. Get in touch with Thomas Weber. Tell him I want to offer him a job. But don't reveal my identity yet. That night, he couldn't sleep for a long time thinking about his plan of action. The system was rotten to the core, but he knew how to change it. It was not for nothing that he had spent so many years building his business empire. It's okay, he whispered into the darkness. Everything will change soon, and we will start with this hospital. After talking to Margaret, David decided to dig deeper. He approached Sophia, who was just finishing her evening rounds. Tell me, does this happen often here? Like with that young doctor? Sophia looked around and lowered her voice. You mean Thomas? He's the third one this year. Before him there was Maria Stern, also a young doctor. She tried to fight the system, wrote complaints. She was quickly asked to leave. And who else? There was Andrei Kowalski, a surgeon. He refused to accept gratitude from patients. He was transferred to the worst duties, and unbearable conditions were created. Now, he works somewhere in Canada. At this point, Paul, an orderly who was wiping the floor nearby, joined the conversation. I've been working here for 15 years. You know, the management used to have at least some conscience, and now everything is open. They don't even hide anything. What exactly do they not hide? David asked. Well, for example, the pharmacy at the hospital. Paul leaned on the mop. Everyone knows it belongs to the Miller family, and the prices there are twice as high as in the city, and doctors write prescriptions only there. And if a patient wants to buy medicine elsewhere, they can refuse treatment, Sophia interjected. They will say that they do not guarantee the quality of drugs from other pharmacies. Their conversation was suddenly joined by Robert, who came out into the corridor. Do you know that we have a paid department on the 6th floor? The conditions there are completely different, like in a private clinic. And do they have many patients there? David asked. Almost all the beds are occupied. They say they even have new equipment. And we are told that the hospital has no money to repair the CT scanner. This information made David think. He took out his phone and added a message to Margaret. Check the financial flows of the paid department. Where is the money going? And find all the contracts for the purchase of equipment for the last 5 years. When he returned to the ward, he overheard a conversation between Michael and a new patient, an elderly man named Frank. My daughter used to work here as a nurse, Frank said. She quit after she found out that some of the humanitarian aid was being sold on the side. How so? Michael was surprised. It's simple. A batch of medicines arrives as charitable aid. Part of it is officially registered and the rest is sold through their pharmacies, but for money. David felt himself getting cold inside. He remembered how many times his company had provided charitable aid to hospitals and wondered how many of those medicines actually reached patients. That evening, he wrote another message to Margaret. Find all the cases of charitable assistance to this hospital over the past 3 years, all documents, all invoices, and prepare a lawsuit to the prosecutor's office. But don't file it yet. Wait for my signal. Are you sure you want to start a war with the system? Margaret asked. It's not a war, David replied. It's a cleanup, and we will start with this hospital and then take on the entire system. Before going to bed, he read all his notes again. The plan of action was becoming clearer and clearer. He would use all his connections, all his resources to break this corrupt system, and he would start by helping doctors like Thomas Weber change the system from within. Tomorrow will be a hard day, he whispered as he fell asleep. But it's only the beginning. The 9th day in the hospital began with unexpected news. Nurse Sophia, barely holding back her tears, said that the same taxi driver who had been sent to another hospital had died at night. They didn't get him there, she whispered, wiping her eyes. Appendicitis burst on the way. Peritonitis. He had 3 children left. David felt something snap in his chest. He remembered the young Thomas who had tried to save this patient and his powerlessness before the system. What's going to happen now? He asked. Nothing, Sophia smiled bitterly. They will write that the patient refused hospitalization or that it was his own fault. He should have applied earlier. Everything is as usual. At that moment, a noise was heard in the corridor. The wife of the dead driver came to the hospital. You are murderers, she shouted. He could have lived. He could have just had an operation. The guards quickly took the woman out of the ward. David saw the chief doctor, Dr. Bergman, watching the scene indifferently from his office. You know, Peter suddenly said when everyone returned to the ward, My sister used to work for an insurance company. She said that every year thousands of people die because they are denied timely medical care. Thousands? David asked again. That's right, but no one talks about it. Everyone is afraid. Doctors are afraid of losing their jobs. Patients are afraid that they will stop being treated if they complain. Nicholas joined the conversation. My wife told me yesterday that 2 nurses in the children's department quit. They could not stand it. They say the hardest thing is watching children die who could have been saved. David felt his hands shaking. He took out his phone and texted Margaret. Urgently find the mortality statistics for public hospitals for the last 5 years and compare it with private clinics. The answer came in an hour. The difference is 4 times. Mortality is higher in public hospitals, especially among low-income patients. And among children, it's even worse. The mortality rate in children's departments of state hospitals is 6 times higher. David felt his breath catch in his throat. He remembered his late wife, who had dreamed of opening a children's clinic all her life. "Elizabeth," he whispered, "I'm going to make this right. I promise." In the afternoon, a commission from the Ministry of Health arrived at the hospital. The officials in expensive suits quickly walked down the corridors without even looking into the wards. "Another inspection?" David asked Sophia. "What inspection?" The nurse waved her hand. "It's just a show. Now they will be taken to the paid ward, then there will be a banquet in a restaurant. In the evening they will write that everything is fine." "Does this happen often?" "Once a quarter. They come, praise the management for effective management, get their envelopes and leave." At that moment, an elderly woman came into the ward, the mother of one of the patients from the neighboring department. "Have you heard? They are going to close our department. They say it is unprofitable." "How can they close it?" Robert was surprised. "This is the only department of this kind in the city. Who cares?" The woman smiled bitterly. "But they will open a paid clinic in that place. They've already found an investor." David became alarmed. "What investor?" "Who knows? Some big medical company. They say they have already bought 5 such hospitals." In the evening, David wrote to Margaret again. "Find information about all the public hospitals that have been privatized in the last year. Who are the buyers? How did the process go?" Half an hour later, the answer came back. "You won't believe it. The main buyer is Med Invest, and its owner is the brother of our Minister of Health." David felt his fists clenching. The system was even more rotten than he thought. "Prepare the documents," he wrote. "I'm coming back tomorrow, and we start acting." "What are you planning to do?" Margaret asked. "First, we're going to buy this hospital. We'll break all their schemes, all their arrangements. Second, we will find all the honest doctors who were forced to leave. We will offer them to return, but for normal salaries. And thirdly," he paused, looking out the window at the evening city. "Third, we will create a fund to help low-income patients, so that no one else dies for lack of money." "They will resist," Margaret warned. "Let them. I have enough money and influence to break their resistance, and most importantly, I now have an understanding of how it all works from the inside." Before going to bed, he walked around the ward once more, looking into the faces of patients and medical staff. Every story, every fate now resonated in his heart with pain and determination to change the system. "Tomorrow, everything will change," he whispered. "I promise." The next morning, a sensation happened at the city hospital. A black Mercedes pulled up to the emergency room, and out of it stepped William Porter, one of the most influential businessmen in the city. "Call an emergency meeting," he told the stunned nurse on duty. "All the heads of the departments, all of them." The news instantly spread through the hospital. The nurses whispered in the corners. The doctors nervously adjusted their gowns. The chief doctor, Dr. Bergman, personally ran out to meet the unexpected guest. "William Josefovich, What an honor! We didn't know. Of course we didn't, Porter interrupted. But I know everything now. The entire hospital administration had gathered in the conference room. Porter looked around the room with a heavy gaze. For 2 weeks, he began. For 2 weeks, I was a patient in your hospital under the name of David Wilson. A whisper spread through the room. Bergman turned pale. I've seen enough in that time, Porter continued. And now you have a choice. Either you all write your resignations right now, or I will hand over all the documents about your fraud to the prosecutor's office and the media. What fraud? Miller tried to argue. We're doing everything legally. Really? Porter took out a folder. Tell that to the patients who were denied care, or the family of that taxi driver who died on the way to another hospital. By the way, he turned to Bergman, how are your private clinics doing? Are they doing well? The room fell dead silent. You have an hour, Porter said. In exactly 1 hour, I will hold a press conference. And if I don't have your statements on my desk by then, he did not finish. He didn't need to. Everyone understood. Within half an hour, most of the managers had written their resignations. Some tried to argue, to threaten with connections, but when Porter started reading out specific facts and figures, they quickly gave up. After the meeting, he went up to his former ward. Patients stared at the man in the expensive suit, not recognizing him as their recent neighbor. It can't be, Michael whispered. Is it you? Yes, it's me, Porter smiled. And I've come to thank you. Without your stories, without your honesty, I would never have realized how bad things were. What happens now? Robert asked. Everything is going to change, Porter replied. My company is buying this hospital. We will completely upgrade the equipment, repair all the departments. Staff salaries will triple. And what about paid services? Nicholas asked. No paid services, only what is provided by law. We will create a charity fund to help low-income patients. At that moment, Sophia entered the room. When she saw Porter, she froze. And to you, he said, I want to offer you the position of head nurse. We need such honest and responsible employees. But I'm just starting out. That's exactly why. You have not yet had time to get used to the old system. By lunchtime, the news had spread throughout the hospital. Some people were happy about the changes. Some were afraid of them. But everyone realized that there was no turning back. Porter personally visited all the departments, talking to staff and patients. In the children's ward, he stood by the window for a long time, remembering his late wife. You see, Elizabeth, I finally understood what you were trying to tell me all these years. In the evening, he called a press conference. The journalists eagerly caught every word. This is just the beginning, Porter announced. We are creating a new model of public-private partnership in medicine. This hospital will be a pilot project. If everything works out, we will spread the experience across the country. And the old management, one of the journalists asked. They no longer work here, and I will personally make sure that they never work in medicine again. After the press conference, a young man approached him. Mr. Porter, I'm Thomas Weber. Ah, the same honest doctor, Porter smiled. I was just about to talk to you. How about the position of chief physician? But I'm young, inexperienced? Porter put his hand on his shoulder. Exactly what we need. The experienced ones had already shown what they had brought the system to. A month later, the hospital had changed beyond recognition. New equipment, renovated wards, friendly staff. But most importantly, the attitude towards patients has changed. You know, Thomas once said during a regular meeting, people from other hospitals come to us to learn. They do not believe that it is possible to work like this. It is possible, Porter replied. You just have to want to change the system and have the courage to do it. In the evening, he stood at the window of his office looking out at the city. On his desk were reports, The number of lives saved had tripled, mortality rates had dropped, and queues had disappeared. The next day, Porter began implementing his detailed action plan. The first thing he did was to create a special fund with a budget of $10 million to urgently modernize the hospital. "Order all the equipment you need," he told Thomas. "Money is not the main thing. The main thing is quality." Then he personally dealt with personnel issues. He sent out invitations to all the doctors who had previously resigned because they disagreed with the corrupt system. Double salaries, social package, the possibility of internships abroad, he listed during a meeting with the staff. But on one condition: absolute honesty in work. By the end of the week, he had introduced a new system of quality control. Surveillance cameras were installed in every department, anonymous complaints from patients were introduced, and an internal audit service was created. "No bribes, no thanks," he emphasized at every meeting. "All additional payments are made only officially, through a charitable foundation." Porter paid special attention to the children's department. He personally oversaw the purchase of new beds and toys and equipped a playroom. "It will be the best children's ward in the country," he promised, the way Elizabeth saw it. On his initiative, the hospital opened a free legal clinic for patients. Now everyone could get legal help in case of violation of their rights. No one would be able to refuse help anymore, citing bureaucratic procedures, he explained. Porter also created a special department to work with low-income patients. Now everyone who could not pay for treatment received help from the charity fund. "Money should not be an obstacle between life and death," he said. By the end of the month, he had signed contracts with the country's leading medical universities for internships for young specialists. "We need fresh forces," he explained to Thomas, "people who did not know the old system and will not reproduce it." Porter personally interviewed each new department head, emphasizing the main thing: "Your job is not to save money, but to save lives. I will take care of the finances." He even created a special psychological support program for the staff. "Burnout is the main enemy of a good doctor," he explained. "We must take care not only of patients, but also of those who treat them."